What role do genetics play in my skin cancer risk? Genetics can influence your risk of developing skin cancer, but it's important to understand how this works in real life. While your genes do play a role, they are just one part of the story. Most skin cancers, especially melanoma, are caused mainly by exposure to ultraviolet light from the sun or tanning beds. About 90% of melanomas are linked to UV exposure, which means lifestyle choices and environmental factors are the biggest contributors. However, your inherited genetic makeup can make you more susceptible to skin cancer, especially if you have certain physical traits or family history. Research shows that genetics can be a strong factor in melanoma risk. A large study involving twins over 30 years found that melanoma has a higher genetic component than some other cancers like prostate or breast cancer. This means that if you have a family member who has had melanoma, your chances of developing it are higher than someone without that family history. But it's important to remember that most skin cancers are considered sporadic, meaning they happen without a known family link. Only about 5 to 10% of melanomas are inherited, passing from parent to child in an autosomal dominant pattern, which means if one parent has it, there's a 50% chance the child might develop it too. Certain genes are linked with increased melanoma risk. The most notable is the SUTACON2A gene. Variants in this gene are found in a significant portion of familial melanoma cases. Other genes like CDK4, TERT, and POT1 also contribute to higher risk. Additionally, genes involved in melanin production, such as MYC1R and MITF, can influence your susceptibility. If you inherit certain variants in these genes, your skin may be more prone to damage from UV rays, which increases your risk. Your physical traits are also influenced by your genes and can affect your risk. Fair skin, light eyes, red or blonde hair, freckles, and many moles are inherited features that make you more vulnerable. People with skin types that burn easily and do not tan, classified as Fitzpatrick skin types 1 or 2, are at higher risk. The more moles you have, especially large or atypical moles, the greater your chance of developing melanoma. These inherited traits can make your skin less resistant to UV damage. Family history is a key factor, but shared environmental factors like sun exposure also matter. When multiple family members develop melanoma, it could be due to shared genes or common habits like outdoor activities and sunbathing. Even if you don't have a genetic predisposition, frequent sunburns, especially blistering ones, can significantly increase your risk. For example, getting 5 or more blistering sunburns between ages 15 and 20 can raise your melanoma risk by about 80%. This shows how your inherited skin type and behaviors interact to influence your overall risk. While melanoma has a strong genetic component, other skin cancers like basal cell carcinoma and squamous cell carcinoma are less linked to inherited genes. Still, certain hereditary syndromes, such as basal cell nevus syndrome, do increase risk for basal cell carcinoma. Conditions like albinism or Fanconi anemia also raise the risk for squamous cell carcinoma. Knowing your genetic risk can help you make better choices for skin protection. If you have a family history or physical traits linked to higher risk, it's wise to practice strict sun safety. This includes avoiding peak sun hours, wearing protective clothing, and applying broad-spectrum sunscreen regularly. Regular skin checks by a healthcare professional are also important for early detection. Genetic counseling and testing may be options to explore if you have a strong family history, but always discuss these with your doctor. Remember, genetics set the stage, but your actions can make a big difference. Protecting your skin from UV rays is the most effective way to reduce your risk of skin cancer, regardless of your genetic background. Always seek personalized advice from healthcare professionals to understand your specific risk and develop a plan to keep your skin healthy.